Welcome to Tuesday's edition of COVID-19. A rather grim milestone today as the world has surpassed 100 million cases in a little over a year since the first infection reported in Wuhan. Meanwhile, authorities in Europe are also seeking to stem the spread of variants, and we are poised to connect with Germany later on in the program to learn more about the efforts there. Now, here first is our Kwon So-ah with the broader pandemic coverage. So let's begin here in Korea for this Tuesday.
Yes, Sunny, Tuesday's COVID-19 caseload has dropped back to the 300s as 354 infections were reported as of 12 a.m., raising Korea's total to 75,875, the death toll at 1,371, and the number of people remaining in quarantine has dropped to below 10,000. Now, in the past week, cases have been mainly hovering in the 300s and 400s, as we can see here on our graph, and the number of average domestic infections, which excludes imported cases, now stands at 369. So with infections lingering in that range, officials and experts are reviewing whether or not to lower social distancing measures in February. According to an official, the government aims to announce its plan by this Friday. Now, the Education Ministry, meanwhile, said this Tuesday that it plans to expand in-person classes for younger students this year, with more staff to be employed to take care of the students and make sure that they maintain social distancing.
I see. So what's the latest with regard to the outbreak at a missionary school in Daejeon that we spoke about yesterday?
Right, Sunny. A total of 133 infections are now confirmed after more than 120 were added in Daejeon yesterday. Now this Tuesday, we see also a surge in Gangwon-do province, and that as 37 students from the IEM school in Daejeon and also a pastor and his wife who visited a place of worship in Gangwon province tested positive. So that is raising concerns that this case is spreading to other places across the country. Now, following Korea's first ever case of a cat being infected with COVID-19 a few days ago, also at a religious facility, pet owners are now worried as well, while authorities say that they are going to announce some guidelines, prevention guidelines for COVID-19 in pets. But for now, they say that animal to human transmission is highly unlikely. Meanwhile, there are around 135 cases of COVID-19 in animals around the world by now, and the number of human infections around the world has hit a grim milestone. As Sunny earlier mentioned, 100 million people have been infected now as of Tuesday, Korea time, a year and a month after the first outbreak, which means roughly 1.3% of the world's population have been infected or were infected with the virus. And if we take a quick glimpse here, we have over 508,000 new infections in the past 24 hours as of noon Korea time, and also more than 10,000 new fatalities. And here we see the 20 countries with the highest numbers of infections. And here, the top 5 here make half of the 100 million infections that I just talked about. And those are the figures I have for now, and I'll be back with more after the government briefing. Sunny?
All right, so thank you for that. I'll see you back at the desk. Right, staying on the international front, we turn to Germany now, where stern measures are leading to a promising fall in new cases, but the presence of variants has authorities on high alert there. For more on the events in Germany, I have Jan Huber live on the line. Hello again, Jan.
Hello, Sunny.
Now, Jan, I believe a hospital in Berlin is refusing new patients after detecting at least 14 cases of the UK variant. Please tell us more about this cluster infection and about last week's discovery of the Brazilian coronavirus variant over in Germany.
Yeah, the situation is still uncertain. Confirmed so far are now 25 cases in 3 clinics now, and still it's not known how much of this English variant, the B.1.1.7, has spread into the city. You know, the situation is like almost 1 year ago when the authorities were looking for patient number 1, trying to narrow down the pathways of the virus. But it's still not known what we can say about this. And so far, it's not yet possible to say whether this variant is more deadly, for example.
I see. Yeah, and lockdown measures in Germany that had been in place since last December have been extended to mid-February. Tell us a bit about these restrictions.
Well, that means that schools, restaurants, shops are closed. You can move freely. But there are already discussions about keeping at least some of these measures in place until Easter, because the situation is a little bit complicated here in Germany. The daily COVID cases and the death tolls, they are going down, but at a slow pace. So I see two different developments here. On the one hand, the discipline is increasing. The people in the streets, they take more care. They keep distance. They are wearing the masks. But on the other hand, I feel a great wariness about it. People have expectations. They are getting tired, and they think that there should be some relaxation, some hope for an end. So the task for the politicians will be to find kind of a compromise between these two developments.
I see. Yeah, and what are the chances of a border closure in Germany as Europe seeks to contain the coronavirus variants?
Well, currently, more border controls have been decided. For example, when you want to enter Germany from the neighboring country, the Czech Republic, you must present a negative corona test now. And the position of Chancellor Merkel is that she wants to avoid border closures, of course. Nobody wants closed borders. But in exchange, she wants to see effective attempts of the neighboring countries fighting against these variants of the virus. That means that Berlin is counting on a common EU policy, but the government is reserving its right to close the borders if necessary. But until now, I mean, we are still far away from that.
Right, fortunately that is. Yeah, and I understand Germany is offering extensive financial support to small businesses and, of course, freelancers to cover a part of their lost income. Tell us a bit more about these efforts.
Well, aid payments for November and December have amounted up to 3 billion euros, and this is easing very much the situation. There's much less anger in the people because of these money transfers. But it's complicated because there are always reports that the money has not yet arrived here or there. And also the aid system is very complicated also to apply. You can't compare it to the situation in the first lockdown last year when the payments were quick and straightforward. Now there's much more scrutiny.
I see. All right, Jan, I'll have to end our talk right there because we have the regular briefing here in Korea starting in a little while. Thank you very much for your thoughts, Jan.
Thank you.
Right, the briefing for this Tuesday afternoon is about to start. We'll come back to you with a summary of the briefing afterwards. Now, I've just had the briefing has yet to start. Now, while we wait for it to start, just a reminder to our viewers here in Korea, the ban on social gatherings of 5 or more people is still in place. The briefing is about to start. We'll come back to you afterwards.
First of all, we have Mr. Kwon Junuk with the explanation on the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for January 26th, Tuesday. As of today midnight, we have 338 new local infections and 16 new imported cases. The total case load now stands at 75,875. We have a total of 71,000 tests conducted, and among them, in the metropolitan area's makeshift screening centers, we conducted 24,364 tests yesterday and identified 38 positive cases. And we also have 1,837 more people being discharged, while 9,711 people still remain in quarantine. And we have 5 more patients with critical or severe conditions, standing at 270, and we had 11 fatalities as of yesterday. And I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now look at the updates on our domestic infections by region. And we have identified a total of 338 new local infections, and about 58% or 196 cases were reported in the metropolitan area. And aside from Gangwon-do province, during the past week, we had a decrease from the previous week on the daily infections as for each of the cities and provinces. And in Seoul's Chunggu, we also have an office space. We had additional cases, and also 30 total cases in Yongsan-gu district, the USFK, and also 10 additional cases at an office space as well, and also 25 cases in a telecommunication company in Ansan. And in Chungcheong province in Daejeon, in relation to an international school, the so-called IM Mission Group International School, we have identified 171 total cases of COVID-19 to date. And in Honam area, as mentioned earlier, this is also another education facility that is run by the IM Mission Group. We have 31 total cases being confirmed. And in Gyeongbuk province in Daegu, Donggu district, we also have 7 confirmed cases in relation to a family gathering. And in Gyeongnam area, in relation to a care facility in Busan, Gimjeonggu district, we also have 17 cases being confirmed to date. And as mentioned so far, we would like to give you some updates on the international school that is run by the IM Mission Group. And in relation to this cluster infection, we have identified in the initial stages, we have seen that 17th and 19th were the first few days of these confirmed cases showing symptoms, and we have confirmed that there could have been exposure to the virus within these facilities. And also during these period of time, we have also confirmed that these confirmed cases have visited many facilities, including restaurants as well as hair salons, and within Daejeon as well as other districts as well. And we are also seeing the possibility of possible local transmissions there. And also we have seen 40 people who attended the one group meeting. We also confirmed that they traveled to Gangwon-do province on the 16th of January, and among them 39 have tested positive. And we also have looked into the 22 facilities run by the IM Mission Group, and we have been disclosing this information to the local governments. And after the 4th of January, we ask you to get tested if you have visited the IM Mission Group or the TCS International School, especially if you have visited these facilities during the latest few weeks. And please get tested by visiting a nearby screening center. And we've done the weekly risk analysis indicators. And starting from the week of 17th to 23rd of January, we have seen that multi-use facilities as well as office spaces and other public places were some places where we had some the cluster infections, and we have seen 0.28, which is the reproduction rate, which is now staying below the 1 threshold. And we also have seen that we are seeing a downtrend of the outbreak. However, there still lingers and persists the risks of possible local transmissions. And here are some details. First, by adjusting the social distancing measures, we are also exposed to higher risks of infection, and this means that resumption of religious facilities, physical services, as well as the operation of many multi-use facilities, we are also exposed to higher risks. And in the metropolitan area and also in the non-metropolitan area as well, we have seen an increase of the mobile traffic during the past weekend. And to this end, we will be carrying carrying out the testings at the temporary testing sites. And we will also continue to urge and encourage people to get tested, especially also having the pharmacies to encourage people to get tested if they come to purchase specific medicines. And as we have more countries around the world which is seeing and witnessing more new variants, we also are exposed to the same risks. And we have seen that the new variants are being spotted at over 60 countries nationwide, globally. And we also see that the UK variant also is more infectious and is more deadly. And we've identified 27 cases of the new UK variant here in South Korea as well. To this end, the government will continue to tighten our borders and also carry out stringent quarantine measures for all of the foreign entrants, and we will be intensifying the tracing for them as well. And at the same time, when when people are coming into Korea, we ask them to continue to abide by the quarantine measures in a strict manner. And as for live quarantine measures, we have the Safety E-Report, which is run by the Safety Ministry. And here are some updates on the latest reports. And there were some reports about religious facilities, gatherings, and also they had retreats, overnight retreats, and they also had group gatherings, including eating of food together. And these were some of the reports that we have seen at these Safety E-Reports. And as for overnight retreats, they also did not wear face masks, and they utilized many multi-use facilities, including the dormitories as well as many other public facilities. And as we continue to urge the public, we could also see a possible large-scale infections at religious facilities. And if they see loosening of the antivirus measures, including wearing of the face mask and keeping social distancing measures, our current downtrend of the virus could be overturned at any time. And to this end, the government will also like to provide detailed guidelines for prevention of virus within the family, and we will be disclosing this to the public as well. And we have done some analysis of the virus during the third wave here in South Korea, and we identified 24% of them were also chain transmissions stemming from family members. And we have seen that one family member has transmitted the virus to at least 1.5 people, and most of them were in the age group of 40 and 50. So here are some guidelines. Please avoid going to other people's houses or other public facilities. And if you have any suspicious symptoms, please get tested as soon as possible. And until your situation is safe, please keep a healthy distance with other family members. In particular, we have the upcoming Lunar New Year holiday, which will be coming in just 2 weeks. And please abide by these measures stringently. And also, as we have many virus vulnerable facilities, and as for the people who are working at these virus vulnerable facilities, and especially as families who are living with the senior age group, we ask you to take particular precautions, especially when you meet people outside your homes. And next, we have some updates on our analysis and R&D on our vaccines and treatment. As for remdesivir, we have administered the drug to about 3,880 patients across 115 hospitals here in South Korea. And we also had some analysis on the after effects of COVID-19. And we have carried out surveys on about 40 confirmed patients who have fully recovered. And we have seen some varied and diversified results among the age group, especially between the age group of 19 and 49. Most of the people had a high level of fatigue, almost 40%. However, over the age of 60, most of these people suffered from hardness of breathing. About 58% of them showed such symptoms. And as for those with light symptoms. 50% of them had fatigue. And as for the severe patients, they had about 50% of 50 of them suffered from the hardness of breathing. And about also 60% of them within the critical patients had also suffered from the difficulties in breathing. While they have seen a decline in the amount of mental disorders, we have seen that they had anxiety and nervousness as well. And also we have seen that 7 of the 40 people had some lung diseases as well as the hardening of the lungs, and all of them were over the age of 40. We would like to note that this is only some interim analysis on certain group of COVID-19 patients here, and thus they cannot represent the entire population. However, we could also imply that there are very high possibilities of adverse after effects of COVID-19, and to this end, the government would like to continue to urge the public to stringently comply with quarantine measures going forward. Last but not least, we would also like to highlight the following. Currently, the COVID-19 situation here in South Korea is definitely on a downward trend. And the size of the patients with severe or critical conditions and the size of the fatality as well as the reproduction rate is also at a very stable rate. And this is all possible thanks to the many sacrifice and dedication as well as the participation put forth by the members of the public. Nevertheless, at these non-accredited international schools that is run by the IM Missions Group, we are seeing another cluster infection stemming from this facility, and we cannot highlight the importance of the quarantine avoidance going forward. And at a very critical moment, we also see continued cluster infections, and this is being repeated. And this means that the 3C environment is not being entirely controlled under the quarantine measures, and this could always can be the hot point of another cluster infections. And to this end, the quarantine authorities will continue to carry out testing and tracing for these facilities going forward. And we would also like to note that even at this moment right now, at unexpected situations, we are also could see that there are infections happening, and this COVID-19 virus is spreading. And it is unfortunate that we cannot control all of these virus spread entirely, and going forward we will also take all very stern measures to continue to carry out investigation behind the virus spread. And in our battle against COVID-19, the R&D aspect is also very crucial. And earlier this morning we have also seen the reporting of the Moderna's vaccine effectiveness against the UK variant as well as the variant from South Africa. And here in South Korea, we are also utilizing the blood plasma that have been donated by the people who have been recovered from the COVID-19. And we are also carrying out continued analysis and monitoring of the new variants. And going forward, we will also carry out necessary research, including the antibodies and so forth. And we will be carrying out these research in a swift manner so that the Republic of Korea can claim victory over COVID-19. Thank you very much.
질의응답에 앞서서 백신 접종과 관련해서 보도하고.
Right, that was Kwon Junuk with Tuesday's afternoon briefing. So he touched upon the outbreak in Daejeon that we spoke about earlier.
Yes, the outbreak at a missionary training school in Daejeon, where now 171 infections are linked to, according to Kwon. And according to epidemiological research, there were already symptoms on January 17th and 19th, and it looks like the virus could have been exposed since January 4th already. And some students there were said to have been to restaurants and the hairdresser in the city of Daejeon. So there are now concerns that this virus could have spread to other places, but not only in Daejeon, but also in other places such as Gangwon-do province, as some 40 people related to that IEM them religious facility have traveled to Gangwon-do Province's city of Hongcheon. So that's why Kwon called on people related to these religious facilities to get tested for the virus. And he mentioned that always when we're at critical moments, for instance, right now, while we are recovering from the third wave of the virus, we observe these cluster infections due to loopholes. So again, he called on those, for instance, unauthorized facilities to abide by social distancing guidelines.
Right, so all right then, thank you for that. I'll see you again tomorrow.
See you tomorrow.
Still on the local front, come next month, Korea launches its vaccination drive. So who will be the first in line to receive the vaccines and why? We have more on the priority list up next.
다음 달이면 백신 접종을 시작할 수 있습니다. 우선순위에 따라 순서대로 전 국민이 무료로 접종받을 수 있도록 하겠습니다.
Korea is now making final preparations to kickstart its vaccination campaign, with residents at long-term care facilities and emergency care workers set to receive their first shots in the first quarter of 2021. They're set to be followed by other healthcare staff and senior welfare workers.
많은 변수가 작용할 수 있기 때문에 우선순위를 결정하는 데는 굉장히 복잡하게 작용할 거라고 생각합니다. 접종률을 높이면서 그리고 혼란을 피하고 안전하게 접종하려면 그 우선순위는 시기와 방법에 따라서 그때그때 좀 조절이 필요하다. 이러한 것은 치밀한 계획과 또 현장에서 시뮬레이션을 거쳐서 현실화돼야 되고요.
So how are vaccine priority groups classified in countries that have already started their inoculation campaigns? In the UK, priority was given to its most senior citizens. Meanwhile, in the US, the first vaccinations were handed out to frontline medical workers and residents at long-term care facilities. The WHO recommends that COVID-19 first responders, elderly citizens, patients with chronic conditions, and the disabled be given the first vaccines. And most countries have identified old age as one of the key factors for consideration. However, Indonesia has gone against the grain by prioritizing vaccines for young people over the elderly. Its rationale is that young workers are likely to come into more social contact with others, which carries with it a higher risk of infection. Many experts here in Korea have also supported the idea that the frequency of social contact should also factor in when setting priority groups. The experts argue that vaccinating socially active people in their 30s and 40s would yield greater preventive benefits.
The adults whose ages are between 30 to 49, they're working ages. So they are more likely to have higher number of contacts during the day, and they're more likely to take a public transport. And if you vaccinate those people, you can also cut the cycle of transmission. So you can cut the chain of transmission.
In some U.S. states like New Jersey, controversy ensued after smokers were given vaccine priority ahead of school teachers, owed to the classification of tobacco use as a chronic health condition by the CDC.
So I know it's a little bit controversial that smokers get the vaccine first. However, regardless of whether choosing to smoke was a good choice or bad choice, based on existing evidence, we know that smokers are at higher risk of contracting COVID-19.
In light of limited vaccine supplies, we must ensure that people in higher priority groups are inoculated first, in order for a successful vaccination campaign.
너무 힘들어요. 그래서 저희가 부득이하게 방역 수칙은 준수는 하되 보이콧을 통해서
손실보상을 제도화하는 방안도 중기부 등 관련 부처와 함께 또한 당정이 함께 검토해 주기 바랍니다.
Talk of comprehensive support for the self-employed who've been bearing the brunt of social distancing measures is taking tangible form, as President Moon Jae-in has urged for a systematic approach to addressing their plight amid the pandemic. For more, I have Professor Kim Se-wan from Ewha Women's University. Welcome back, Professor Kim.
Thank you for having me.
And I also have Professor Cho Hee-kyung from Hongik University. Pleasure to have you with us, Professor Cho.
Hello, good to be here.
First then, Professor Kim, what has been the impact of social distancing guidelines on self-employed workers?
Yes, there's no question that self-employers are the hardest hit part of the economy from coronavirus pandemic. But unfortunately, there's no concrete data that shows their economic pain yet. According to government's official data, the number of self-employers peaked at 5.6 million in May of last year, but that decreased down to 5.4 million in December of last year. That means number of self-employers decreased by 200,000 in last year. So approximately, we can say that there was about 6 trillion won GDP loss due to decrease of self-employers. But there's another evidence from credit card companies' survey that self-employers, particularly in service industries, sales decreased by 30% altogether in the last year. And according to another survey from Chamber of Commerce in Seoul, the hardest hit part of the self-employers, particularly in karaoke and PC cafes, sales or revenue decreased by 90% in the last year.
I see. And that is precisely why, Professor Cho, President Moon Jae-in has called for an institutional approach to compensating these self-employed workers for losses linked to COVID-19. What are the implications of such an approach from a legal perspective?
Right. You mentioned in your introduction a systematic way to compensate these people, and that's really the key word here, because we've had already a number of one-off payments for small businesses as well as individuals. But obviously, every single time they have implemented such a measure, they had to haggle about the budget and the amount of compensation that would be available. And so instead of having to go through that process each and every time, what I think the president wants to do is to have a system in place whereby you would be able to compensate these small businesses who are really hurting. You know, I dare say that all of us around this table haven't really suffered in terms of, you know, a drop in our income as a result of COVID, because we have salaried jobs and that haven't really been affected. But I know so many small business owners who are really, really hurting. They've burned through all their savings. They have credit card debt. They have, you know, mortgaged everything up to the hilt, and they really need help.
Right. And these people, Professor Kim, they account for a great number of self-employed workers here in the country. Can you tell us more about this reality, that we account for about 25% of self-employed workers as compared to the 13.7, is it, of the average of G7 countries?
Right. One thing very unique feature of Korean economy is that self-employers cover a quarter or 25% of total employment, while other advanced countries self-employers covers only less than 14% on average. This larger size of self-employers is related previous economic shocks in 1997 and 2008, because that shock did not provide enough decent job opportunities in regular employment. But the fact is, without recovering self-employers' business status, there's no economic recovery in Korea. And all these factors became a political reason why both of ruling party and opposition party are rushing to enacting loss compensation law.
I see. Professor Cho, what can you tell us about efforts overseas to better deal with the sufferings of the self-employed?
We can actually find lots of examples abroad. And so this is why I do have to make a comment about the Deputy Minister of the Ministry of Finance and Economy, because when the government sort of initiated this impetus towards having a systematic scheme to compensate for the loss, Mr. Kim Yong-bom said something like, it's difficult to find precedents abroad, and it would be difficult to do. And I really thought that was such a bureaucratic, almost a lazy response by a high-level government official, because there is a lot of different ways of skinning a cat. You don't have to just have one particular way. There's no right answer to this. You can have things like job retention scheme, which is already in place in countries like in Britain, Germany, where the government actually subsidizes salary for employers so that they don't have to fire those people who can't, where they can't pay the salaries. You also have tax relief, so the businesses are basically forgiven tax, or the tax is deferred for a long time, so they don't have to contend with these costs. There are also schemes whereby they actually have actual payment for fixed costs of businesses. So in Germany, they've just increased the monthly limit of these fixed cost support to up to 1.5 million euros per month, up from 500,000 euros. And so these countries are really throwing the kitchen sink at the problem to try to help these businesses that are struggling, because they know that if they are allowed to fail, it'll be so much more difficult for the economy to build up again once the COVID has become under control.
Right, and hence Korea's efforts to come up with a compensation plan for workers here. What are your thoughts, Professor Kim, on the actual guidelines for compensation, including who and perhaps how much?
Well, as we have seen in previous emergency cash-out programs, who is going to be a recipient and how much they are paid are not easy decisions, because the recipients should be fairly selected, and government has to consider the economic impact of that program. But the rough agreement on this program is about 50 to 70% of the business loss will be compensated in the long run. So that made particularly the businesses that were banned or restricted over social distancing will be compensated in the first stage of the program.
I see. Professor Kim used the word fairly before his response. Yes. Professor Cho, in order to ensure a fair compensation, there have been calls for a clear legal framework.
Right.
What should be included in that framework?
So, the Deputy Prime Minister actually referred to Article 23 of the Constitution to justify his call for loss compensation scheme, because that clause deals with expropriation by the state of private property. And the main target for this particular loss compensation scheme are those businesses who are directly affected by the administrative orders that were imposed by our government to either shut down or shorten their opening hours, and that has resulted in direct loss of business and revenue for them. And so, the Constitution says if you expropriate private property, then the government has to pay just compensation, right? And so that gives us a perfectly valid constitutional basis for this scheme, but the devil is always in the detail. And so, how do we actually, craft a fair scheme, one where we spend taxpayers' money wisely, and one where the scheme does not get abused and misused by ill-intentioned people, because we certainly don't want to have a situation where we are propping up zombie companies, businesses that should have gone under long ago, by giving these kind of subsidies. But we can also see from examples in other countries, and they've also had trial and error implementing these schemes. So, for example, we have businesses where it's very clear what their revenue was, what the drop in the revenue was as a result of the books that are kept clearly with certainty and transparency. But we also have problems with, for example, freelancers who are self-employed but who don't have regular income. Their income is very seasonal or dependent on certain events. And so how do we actually calculate, what their compensation amount should be, and so on and so forth. But these are problems that we can overcome by paying attention and looking at who needs help most urgently and addressing those first.
Right. And keeping in mind what Professor Cho has just said, Professor Kim, the question now, I suppose, is do we have fiscal headroom for such a compensation plan?
Well, first of all, there is a growing concern on the fiscal health of the Korean government because the government debt is increasing very quickly. Due to last year's 4 times of supplementary budget and the super budget of 558 trillion won of this year, the government debt to GDP ratio, which is the barometer of fiscal health, will surpass 50% this year. This is what we are worrying is the speed of government debt increase, not the size as of now. But I still think that the higher priority should be given to fiscal expansion than physical health, because if this kind of pandemic shock continues over like 2 more, 3 more years, that really hurts the economic growth potential of the Korean economy by hurting job opportunities, particularly of the young workers. So we have actually 2 ways to finance the government's debt and government's fiscal expansion. One is printing money. That means Bank of Korea will print the money and buy all the debts or government bonds. But here comes the concern of the higher inflation in the longer term. But another way to do that is government can sell the bonds in the private market that households and banks can buy government bonds. So I think there should be compromise between these 2 ways of financing government debt.
I see. Professor Cho, the ruling Democratic Party is hoping to secure parliamentary approval for the compensation bill that we're talking about by next month. Is this a feasible plan?
There's no reason why they couldn't pass the bill by next month. They have almost a supermajority in the National Assembly. So if they put their mind to it and if they come up with a reasonable, workable bill, there is absolutely no reason why they couldn't actually pass it even tomorrow if the National Assembly was sitting. I keep sort of citing the German example, but this is how seriously they're taking this issue there. They even changed the law with regard to the quorum for their own National Assembly to enable fewer people having to attend the National Assembly for the fear of spread of COVID, but yet be able to actually do the legislative work by being able to have, let's say, for example, the German National Assembly is 600 people, and before you needed, let's say, 400 people to be there to pass a bill. They've decreased the minimum to 300, in order to be able to pass the bill. And so if there is a will, there is always a way, right? And I just wanted to also touch a little bit about the GDP and the national debt and all of that. And I understand the concern about fiscal responsibility and all of that. But if you're talking about fiscal rectitude, Germany is the post child for that. And yet even Germany is really they're sort of they've taken away the brakes. They've said, whatever we need to do to keep the economy going, whatever we need to do to solve this problem, which is literally once in a century problem. This kind of pandemic is such a black swan event. It's not going to happen again in our lifetime. And so whatever we need to do to be able to solve the problem, that's what we have to do. And the debt ratio of our budget, it's really a number, just a number. And if you recall the fact that if the economy is shrinking, then the debt ratio is just going to go up, right? And so we have to keep that in mind and not be tied down by just a number that prevents us from being able to do what is actually needed.
Right. Professor Kim, there are some who are claiming that the legislative protocols may actually delay assistance to those who are in need, and they're urging for prompt and practical support instead. How do you respond?
Well, we do not exactly know how long it's going to take to enact loss compensation laws, because there are lots of uncertainties in politics. So to facilitate government support on self-employers and small businesses, I think two kinds of supports are important. The first is the government can provide tax benefits to landlords that cuts the rent to small business owners and self-employers. And the second is the banks, the commercial banks can delay self-employers and small businesses who are suffering from pandemic interest payment and principal payment. But actually on this part, there is an issue of a moral hazard for delaying interest payment and principal. So at least the commercial banks can roll over the loan to small businesses and self-employers for several more years. That's going to be another big help to small businesses.
Right. Very briefly speaking, Professor Cho, there is also concern that the government is placing too much attention on a single demographic group instead of focusing on the hardships faced by the entire country. What are your thoughts?
There's absolutely valid, that's a really valid criticism, because as Professor Kim mentioned earlier, having a generation who are unable to find work as a result of this pandemic, which is happening to our recent graduates now, it's going to affect them for the rest of their lives. Their income will be depressed for the entire lifetime and not just right now. And so obviously we need to be able to help the small and medium-sized businesses who are really hurting as a result of the shutdowns, the shortened opening hours and so forth. But we do need to keep in mind the long-term effect of the pandemic and have other systematic programs whereby we can help the younger generation to help them find jobs, even if they are created by the government, in order to set them on their way.
Right. All right, Professor Cho, as always, thank you very much for your insights. And Professor Kim, thank you very much for being with us today.
Thank you very much.
Thank you.
Right, well, let's hope for an end to the pandemic this year to ease the hardships faced by small business owners and freelancers, and of course, all those responding to the challenges posed, including frontline workers across the world. Thank you for watching. See you tomorrow.